Today we are diving into a topic that is often whispered about but deserves a bright, clear spotlight: colon cancer. In honor of March being Colon Cancer Awareness Month, I'm here with Buckeye Health Plan Medical Director Dr. Kambelos to discuss the signs, treatment, and life-saving screenings related to this disease. And Dr. Kambelos, thanks so much for being here. This is such an important topic.
I agree, and it's always a pleasure to be with you.
All right, so what is colon cancer and why is it important to discuss?
Well, colon cancer is when abnormal cells develop and grow in the colon or large intestine and can grow into tumors and polyps. And it's so important to discuss. It's a delicate topic. However, it is one of the leading causes of cancer death in Ohio, and it is one of the cancers for which screening is very effective. So the bottom line is we want to screen more Ohioans for colon cancer because the bottom line is it saves lives.
Absolutely. So Dr. Kambelos, who is at risk for colon cancer and what are the controllable and then uncontrollable risk factors?
We are all at risk for colon cancer. There are some risks we are unable to modify, such as our age. It's more common as we get older. We're unable to modify, obviously, our race, our genetic makeup, and family history. Things we perhaps can modify are risk factors like a poor diet, obesity, sedentary lifestyle, being inactive, and of course alcohol and tobacco use.
Yeah. What are some of the common symptoms? I know people are going to want to know that. How do I know if I am headed down that road? What are the symptoms?
Regretfully, in the early stages, there may be no symptoms, hence the vital importance of screening early on. In the more advanced stages, the symptoms could be variable and overlap with other syndromes. So here again, important to see the doctor. But abdominal pain that persists, a change in the bowel habits, rectal bleeding, and unintended weight loss, those are all red flags for which immediate medical attention should be sought.
Yeah, and that's so important to screen for colon cancer, even for people without symptoms, right?
Absolutely. Yeah. And as we mentioned earlier, this is one of those types of cancers for which screening is in fact very effective.
Yeah. Why should people start screening for colon cancer? Is it some of those risk factors that you mentioned?
Yes, and really this is, and we touched on it a little bit earlier, it's one of those that's easier for which to screen early on. And if caught, let's say, in the early stages, the polyp stage, the precancerous polyp stage, for example, the polyp can be removed, therefore reducing the risk at that time. So, you know, early screening works and is effective in saving lives.
And when should you start? I mean, I know that at 50, they say that you should have your first colonoscopy.
And it used to be 50 up until just a short time ago.
Oh.
So, very good point. It is now 45. And it's 45 because we start to see the incidence increase at 45. Now that's for average risk individuals, so we start at 45. Now for individuals who are at higher risk, let's say an individual with a first-degree relative like a parent, a child, or a sibling who's already been diagnosed, we typically start screening 10 years before the age when that individual was diagnosed. And of course we're talking about screening guidelines, not follow-up or diagnosis guidelines when someone's already been diagnosed with malignant colon cancer or polyps.
Now, it used to be every 10 years that you should be screened. Has that changed too, or?
It depends on the screening test that we're looking to employ.
Okay.
The gold standard is still colonoscopy, so direct visualization, going in there and taking a look. That is typically recommended every 10 years. However, there are other tests that are available to screen for colon cancer, and those intervals vary. Let's say, for instance, the DNA stool test, where a specimen is collected in the home and sent to the laboratory for processing for evaluation for abnormal DNA in the stool. Now that test is done typically every 3 years. Another test that's called a short scope or a flexible sigmoidoscopy, and that's often done in the office. That can be done every 5 years. There is another test that can be performed that's a little bit newer and not employed as commonly, but it is available and it's appropriate. And that would be a screening colonography or a special CAT scan that looks at the colon using a special machine called the CAT scan. And that's done typically every 5 years.
Okay, and what does Buckeye Health do to support colon cancer care and prevention, importantly?
Well, our motto at Buckeye Health Plan, as you know, is that we are improving the health of the community one person at a time.
Yeah.
And we sincerely care about our members, and it shows in the way we surround them with the kinds of care, assistance, and guidance that they need to successfully proceed along their healthcare journey. We cover colonoscopy, colon cancer screenings, I should say, at 100%, so there's no cost to our member. And in addition, we actually reward them with My Health Pays rewards dollars that they can use for payment of rent, let's say, or towards payment for healthy groceries. So there's not only the full payment for the service, but also a bonus payment on top of that. And as always, we provide free transportation to our members so that getting to and from medical appointments is really easy.
So what does Buckeye Health Plan do? A lot. You can believe that. Dr. Kambelos, thanks so much for being here. We appreciate it. And for more information about colon cancer, all you have to do is visit buckeyehealthplan.com/preventative care.